I'm currently an ENT resident that transferred from family, and so now it's currently March, so it's been a good number of months. I think this is now like the 9-month mark since I have 9-10 month mark since I've transferred. And I just wanted to reflect on how that's gone. There's definitely been times where, like, this whole transfer, I've like questioned it. Those are the times where I've been actually just like last month so this is my 4th weekend on call in a row. And during my last rotation within 3 weeks, I was on call like 1 and 2, which means every second day for like so many days straight, including the weekends. And so I think that's makes it really hard sometimes being on call. It really, at least our call, it's quite busy and you can be up all night, but then we don't take post-call days in ENT in my children's rotation, and I really enjoyed that. The preceptors there are just like so nice, very hands-on, and the surgeries, some of the surgeries are tonsillectomies and ear tubes are easy for someone my level to learn. Like, I'm really not at the level that I can learn head and neck flaps, that's like way out of my league, for example. But learning how to put in an ear tube, learn how to do tonsillectomy is something that I've just over the span of a few weeks was able to see like development in my own skill, which was awesome. Still got a long way to go. But being a surgical resident is like, like you're in the OR, but you're also managing the ward at the same time. So all the patients that are admitted under our service, like all their issues or all our post-ops, like you're kind of dealing with pages from the surgical start stay unit, or in the longer unit. And then all the inpatient wards are like consulting you, the emergency department's consulting you. I think as time goes on, I'll just get faster at dealing with stuff on call, so it shouldn't take all night if I'm like faster at it. I think another thing is just like the constant feeling of being like super incompetent. Whenever I start a new rotation, I'm always like, I don't know my staff preference, like what my preference is. Like each staff has a particular way they want to drape it, or what their post-op orders are, things like that, or even how they want to do the surgery. And I don't know that, and I just like want to be helpful. Like I want to be able to like drape and set everything up before my staff gets there, and I like feeling like I can be helpful so that like the time that I slow everyone down for my learning, I'm like compensating for, so that I'm not making the nurses days super long. So I would say that feeling of like starting every new rotation and feeling like you're slowing people down and you're not speeding the process up, that's a feeling I just like don't love. I would say learning surgery is like super thrilling. It's super exciting. There's some really cool stuff that you got to see. Like this week I got to see like a lung, and I got to see them like chop a piece of lung out. It was pretty cool. And we did just do that, and it's just so routine for everyone, but you step back and you think how like unique an experience that is. Is really cool. Being able to see my own confidence in like procedures, so for like just not knowing how to do a peritonsillar abscess drainage at all, to being able to do that independently now, or being able to pack a nose for an epistaxis independently. Those are all things, they're different things that I'm still learning to juggle, but how to manage my time to get research done and studying done, and keeping your house clean and things like that. Most, except for very few of my medical school friends, are now graduated and are working as staff. Like my old friends back from med school, I'm the only one left who's still a junior resident, as opposed to people who are now senior residents and attending. So you get less people to complain about the process of how rough it is sometimes to be a junior resident. I really like my resident group a lot. I feel like the seniors really look after us, and I can go to when I'm struggling for something or want some help, and I really feel like they have your back. I really like a lot of their staff. I really feel like the staff are good about like taking the time to teach and let you try and let you struggle and let you struggle to like learn stuff. I heard that first and second year are the hardest parts of residency. If you just get over the hump, they said third year is an amazing time, and then 4th, 5th year, like besides writing your Royal College, which is super stressful, other than that, it's a wonderful time, and staff life is supposed to be really good. So that's what I keep telling myself when times are hard, that things will get better, and they'll get better pretty soon before I know it. So yeah, that's how surgical residency's been going.